Bring out your 3 fingers again. The fingers from the right is what you use to check on your left breast. So you start from here to press on it. Press it down, get towards your armpits, press around it to see if there's anything that is abnormal. Breast cancer is the most common type of cancer amongst women worldwide. And let's not forget, men also get breast cancer. Yes. But when this cancer is actually detected early, survival rate is incredibly high. Your first line of defense is not a high-tech machine, but rather our little fingers and just the moment of mindfulness. And the entire month of October is Breast Cancer Awareness Month. So this is a month that is dedicated to creating awareness about breast cancer and how important it is for us to detect it early. Early detection, prevention, and screening. It serves as a reminder to let you know that your vigilance matters all year round. Monthly, just use these fingers and check on yourself to know if everything is okay. And if you notice any abnormality, you can now go and get yourself checked out. And let's not forget, the goal is not just to find cancer. Rather, it is to find it when it is still small, localized, and manageable. Because then your treatment and survival options are significantly better. So think of your breast health as a path that you take every day, because that is how familiar you should be with your entire body, because of course you are always with yourself every single time. So if there's any change or anything that is abnormal or tree just blurts out of nowhere, you should be the first person to notice this, right? So monthly, take this as a duty to yourself to always check on yourself. Check on your breast to know if there's anything new. You can do this standing in front of a mirror. You can do this laying back, laying flat on your back, and I'll explain how you can go about this. But this is just a way to remind you that it all begins with you, because that is your superpower in the fight against breast cancer. Knowing what is normal for you. And the first thing you should do is know your normal. That is, get acquainted with everything that has to do with your breast. So once a month, once you get out of the shower, take 2 to 3 minutes to just feel your breast. You don't need to stress about anything right away. The goal is just to look out for something abnormal. So this is how you go about it. With your 3 fingers, remember, you're going to be doing this naked. You're not supposed to be wearing any clothes so that you can have a proper feel of your breast. So with your 3 fingers, you use your fingers from the left to check on your right breast. So you just go about pressing on your breast, check around it. Just know the normal thing that is supposed to be there around your armpit area. You press on it firmly, check for the size, check for the shape, check for the texture and natural lumpiness that's supposed to be there, because of course every breast has a lump, the natural lump in there. So you just go about pressing on it firmly to be able to tell if there's anything you're feeling that is not supposed to be there. Do not worry about anything and just pay close attention to your body and every single touch you're giving yourself, so that you know if there's anything that is not right in there. And another way you can go about checking this is to lay flat, on your back. I don't have a bed here, but I'll just try to show you how this can be done. You lay flat on your bed and put your hand behind your head. And remember, you bring out your 3 fingers again. The fingers from the right is what you use to check on your left breast. So you start from here to press on it. Press it down, get towards your armpits, press around it to see if there's anything that is abnormal. Just keep pressing around it. Go around your breast, check under, press every single area around your breast. And at some point you have to check your areola, that is your nipple, and squeeze it to see if there will be any discharge. If you notice any discharge or you feel any pain at any spot at all that usually you don't feel, but now you're feeling a pain that is persistent in a particular spot, then you have to reach out to your doctor. Second of all, you need to know that you have to be a detective about this, because that is the whole point, looking out for things that are not right. Okay, so when you're done checking and feeling your breast for any lumps or any thickening or any dimples, if you were actually looking at it in front of a mirror and you noticed any dimple, just like the natural or the cheek dimples. I don't have it, but you get my point. The dimples, if you notice any part of your breast has like a dent, has gone in, if there's any discharge, then the next thing to do is to get professional screening done. So you reach out to your doctor and get your breast checked out. And please take note, the best time to examine your breasts monthly is a week after your menstrual period, because that is when your breast is less likely to be tender, or painful or bigger. You understand? So after a week, when everything has gone down, you go ahead and examine your breast so that you can get a better result. After your professional screening, if anything is detected, of course, your doctor would schedule a mammogram for you. This is just a low dose x-ray that is carried out on your breast tissue to test for any lumps. And this can actually detect any lump early enough before it can even be felt. So this is like a good head start. As an expert of your own body and your own best advocate, make a promise to yourself this October, being Breast Cancer Awareness Month, to be more proactive. Start feeling your breast monthly for those lumps or those abnormalities, because your health is in your hands. Join the fight against breast cancer.